Hello, and welcome to the Metro Dallas Homeless Alliance 7th Annual State of Homelessness Address presented by United Way of Metropolitan Dallas. I'm Jennifer Sampson, McDermott Templeton, President and CEO for United Way of Metropolitan Dallas, and I'm so proud to join you today. And while analyzing and understanding the data is important, we all know that. What we do with this knowledge, how we use the data to drive measurable change, is essential. United Way of Metropolitan Dallas is a founding member of the Collaborative on Homelessness, a coalition of local philanthropy committed to supporting transformational change to end homelessness in Dallas and Collin Counties. Together with nonprofits and community leaders, we will create a strategic, coordinated, and measurable system of service that empowers and accelerates individuals to achieve permanent housing. That's lasting change. And driving lasting change is central to our work at the United Way of Metropolitan Dallas. We envision a community where everyone, regardless of race or zip code, has the access and opportunity to achieve their full potential. Aspirational and achievable, you bet. Because we partner with a community of committed corporate citizens, civic leaders, and nonprofit organizations to ensure that all North Texas students will graduate high school prepared for success in college or career. All North Texas families are financially stable, and all North Texans are living long and healthy lives. We cannot realize this vision or achieve these goals if MDHA does not achieve its goal to make homelessness rare, brief, and non-recurring in Dallas and Collin counties. Because housing security for all North Texans is core to our work in education, income, and health. Without a house, a child can't get a good night's sleep or have a quiet place to study. A mother will have a really hard time keeping a job when she doesn't know where she and her child will sleep at night. A home also improves a person's health by providing safety, shelter, warmth, and clean water. If there's anything the past 14 months have shown us, it is that in Dallas and Collin counties, we can do anything we put our minds to. How difficult could it really be in an area that is home to almost 3.7 million people to house a few thousand more? Aspirational, yes, and achievable, you bet. Dallas and Collin counties can and should be leading the country in ending homelessness. And the only way that will happen is if we have an effective and efficient homeless rehousing system supported by all of us, led by the strength of MDHA. Now it gives me great pleasure to introduce our two main speakers for today's State of Homelessness address. Peter Brodsky, the chair of the new MDHA Board of Directors, and United Way of Metropolitan Dallas's very own Executive Director of Housing Stability and SVP Community Impact, the chair of the new board of the Homelessness Collaborative of Dallas and Collin Counties, the one and only Ashley Brundage.
Thank you so much, Jennifer. On behalf of Ashley Brundage and the entire board of the Metro Dallas Homeless Alliance, I'd like to welcome you to the 7th Annual State of Homelessness Address. We're here today to discuss a big problem. So many people, too many people in our community are experiencing homelessness. We're fortunate in our community to have over 80 organizations, both nonprofit and public and governmental agencies, who fight every day against this problem to help our neighbors experiencing homelessness. And I want to extend my thanks to them for that work. Metro Dallas Homeless Alliance, or MDHA, is the organization that coordinates the homeless services ecosystem in our community. With our partners, we seek to make homelessness in our community rare, brief, and non-recurring. We absolutely could not do this work without the support of our philanthropic partners. For this event specifically, we want to thank the presenting sponsor of today's State of Homelessness Address, United Way of Metropolitan Dallas. Today's supporting sponsors are City Square, Downtown Dallas Inc., Doctors Deborah and David Woody III, KDC Holdings, the McManaman Family Fund at Communities Foundation of Texas, Metro Care Services, and WAK Management. To all of them and to all of the associate and event sponsors, thank you. Your support of MDHA is a testament to your understanding that the only way we will end homelessness is through collective impact, with everyone working together towards one common goal. We hope you will walk away from today with a few key messages. Number one, the importance of collective impact, of everyone in the homelessness ecosystem working together. Number two, we want you to understand how we have reorganized the continuum of care for Dallas and Collin Counties, which we're now calling the Homeless Collaborative, and how that reorganization will allow us to revamp the homeless rehousing system. Number three, data, data, data. We understand the importance of being a data-driven ecosystem. And finally, we want to provide to you the latest statistics that we've got on homelessness in our community. We will hear from my co-interim CEO, Ashley Brundage, and she is also the board chair of the Homeless Collaborative. She will explain the reorganization of the ecosystem and why we think it'll improve our collective impact. We are also going to hear from some Homeless Collaborative leaders about how their organizations adapted in the pandemic, both the challenges and the opportunities that were presented. But before I hand it over to Ashley, I want to invite you to submit any questions that you may have in the chat box at any time. We will answer your questions there.
Thank you, Peter, and thank you to Jennifer for an incredible welcome to this event. Welcome to everyone watching today. I'm so excited to be here with you. As many of you know, homelessness does not exist because of one single factor, rather a series of forces that manifest as homelessness. And the systems in place to help prevent and end homelessness are just as complex, but can be broken down into 4 parts. Prevention programs that stabilize individuals to ensure households do not fall into poverty. Housing creation to actively expand affordable housing as well as access to affordable housing. You're most familiar with rehousing services, where we engage people living in homelessness, bring them into shelters, and then rehouse those individuals. The final piece is street services to manage and care for individuals living on the streets, including comprehensive integrated primary and behavioral health care. In what I like to refer to as one of the first examples of collective impact, HUD mandated an umbrella strategy addressing homelessness and created the concept we call a continuum of care. The continuum of care brings the 4 parts of the homeless system under one umbrella. In Dallas and Collin Counties, we've named our continuum of care the Homeless Collaborative. This community advisory board is comprised of diverse system stakeholders with the mission to make homelessness rare, brief, and non-recurring. The Homeless Collaborative will take a systems approach or a collective impact approach to rehousing persons and families experiencing homelessness in Dallas and Collin Counties. The key to this work is our collective will to engage with the system, empower our work groups, and align on priorities. We will amplify what we know works, rethink how we prioritize populations, and streamline the way we allocate resources, all to meet our goal of ending homelessness. As of January 2021, the new board members that you see here have stepped up to the plate to ensure we work together collaboratively. I'm so proud to chair a board of such extraordinary leaders. Our new Continuum of Care Board of Directors is made up of systems-level leaders with the clout and network to ensure success. This board has the power to drive multi-sector solutions to end homelessness in our community. And I know we have the right people at the table to meet the big challenges in homelessness that we face every day. The governance of this system is not just the 2 boards that we've mentioned today from the COC and MDHA. It includes multiple layers of participation for all stakeholders to engage in an action-oriented way. We have 25 work groups currently underway across the system who've been charged with delivering on the objectives that help us meet our goal of ending homelessness. The Homeless Collaborative contracts with MDHA to be the lead agency, meaning MDHA is the staff of the Homeless Collaborative. MDHA, as the lead agency, activates and actions the strategic vision of the Homeless Collaborative, and the reconstituted MDHA board works to ensure that MDHA has the resources necessary to achieve the vision of the community.
MDHA accomplishes this by leading those 25 work groups comprised of you, our providers, the experts in your fields, to create and shape the policy needed to move the system forward. This structure allows us the opportunity to consolidate work, streamline efforts, and avoid duplication of efforts. In Dallas and Collin Counties, we have big plans to end homelessness for our citizens. But as I've shown, that only happens with all of our partners working in tandem, and we have some incredible partners. We recognize that the past year has been hard and is constantly changing, especially for our frontline providers. Together, we experienced shelter-in-place orders, we quarantined, we had one of the worst winter storms in over a decade. We struggled to get all of our community members tested for COVID, and now we're working to get our community vaccinated against COVID. Let's now hear from key leaders in the Homeless Collaborative about what stood out to them over the past year and answer, how has COVID-19 affected the homeless rehousing system?
COVID-19 has been devastating and disruptive for those experiencing homelessness in the sense that it's really made it hard to provide services for those who are already experiencing homelessness. We've had fewer shelter beds, fewer services available. It's been very isolating and kind of a period of neglect for those who are already chronically homeless. And then on top of that, we've had this economic disruption that is leading people to face homelessness for the first time in their lives. So it's really hit people in multiple ways.
We did see about the same number of families coming to us as we had in prior years, but they were more urgent, more critical, and needed a deeper level of services than families that we've served in the past.
Poverty, and especially homelessness, are the storm that nobody sees. And the pandemic awakened everybody to our shared humanity. And I think really put us all on a level playing field and cultivated a new sense of empathy and urgency around poverty and around homelessness.
The silos that we used to operate in, they were no longer going to allow us to have meaningful impact when it came to addressing homelessness. And so what we began to do, it tore down all of the walls and barriers that we had with our service providers and our partners. It allowed us to really figure out how the city could approach it in partnership more so than just a conduit for resources.
I would say that during the pandemic, the homeless service provider community came together in ways that we hadn't in the past. We met together almost every single morning at 8 o'clock, for one thing. As 2020 progressed, we met less frequently, but we continue to meet once a week. And so I think that all of us coming together and trying to help each other and learn from each other and combine resources in ways that we had not was something interesting we saw during the pandemic. So by way of example, some of our shelter providers in the community who serve only individuals or who serve individuals plus families with children had to reconfigure their space to serve more individuals, which meant that we took on a bigger role in taking their families with children and serving them. So we planned together and worked together to make sure that we were leveraging each other's resources, I think, in ways that we hadn't in the past.
I think the biggest lesson is to stay close to our partners, because the work is a team effort. The only way we can do that is if we've established those relationships ahead of time, and we know if there's a need, we can sort of bring our part of the solution to the bigger need. But we're not the primary housing agency. We're not the primary agency that deals with that piece of the equation. But wherever we can, we want to be able to sort of bring our services to bear to be, to help with that solution as best we can.
How do the cities work collaboratively to address that? Because what I know and what the pandemic has shown us is that, one, we already knew this, but it's honed in on the fact that, one, government can't do it by themselves. We just can't. We don't, not just because we don't have the staff, but we don't have the expertise that a lot of our nonprofits have. So the pandemic has allowed us to work with some nonprofits that we may have never worked with before on at-risk of homelessness type activities, but as well as homeless activities. There are a lot of wraparound services that individuals need, and that's the same thing here in Collin County. So I don't know if a week goes by that I don't talk to one of my sister cities. I know that 2 weeks doesn't go by that I don't talk to someone on the county level, all trying to address homelessness. So the pandemic has been a beautiful thing in allowing us to not just say we collaborate, but to actually look and see how we're going to do it and act upon it.
So some of the things that we did obviously there were challenges with spacing and social distancing. So it really encouraged us and incentivized us to open up our Kay Bailey Hutchison Center to allow for the ability for people to have more space and the providers to have a little bit more flexibility in how they house individuals. Additionally, during the pandemic, we bought 2 hotels to actually serve as COVID sites for people that might have come down with COVID and were in some of our homeless facilities. It's really encouraged us and actually pushed us towards being more responsive and assisting in figuring out how we can play an active role in working with our partners.
Like a lot of health systems, we just revamped a lot of the way that we deliver services, and so specialize and customize services a lot more. We've always had an effort where we try to target services to the people most in need and use our data to try to identify what those needs are. But early on, we knew that there was people at risk, people in nursing homes, people in homeless shelters were going to be more at risk, congregate settings, right? And so we used our teams to do some consulting, infection prevention, how do you sort of set up sites. As we learned, we tried to share that learning.
Analyzing the data, really looking at why families are coming, it gives us opportunity to offer the appropriate intervention for that family situation, which isn't always shelter. There's a lot of creative things that we can do in the diversion world. Diverting families from shelter is always less expensive than putting them in shelter.
So one of the things that I believe was highlighted during the pandemic was the inequities and the disparities in many of our communities. In homelessness, as we knew prior to the pandemic, it was heavily concentrated, and we saw a disproportionate amount of homeless people that happened to be African American and actually African American males. And you see that when you ride up and down our streets. And so if there's anything that we've learned is the work that we've done to look at the data around equity and the indicators that show where those inequities are. They've actually helped us during this pandemic. One, in the vaccine distribution, in our testing, we knew exactly where we needed to go to really address the hardest to reach individuals. And I think homelessness is another one of those markers that as we look at the homeless population here in Dallas, the data already reflects where we need to at least exert more energy, look to provide housing stability as well as housing offerings, and or where we need to really go and use our service providers to really lean in and go and reach these individuals in the areas that we know are the hardest hit. And so we'll be utilizing data to really back up many of our efforts, particularly since resources are scarce, to know where we need to expend them, what populations we need to focus on, and then find ways to, again, for the broader good, focus on those disparities to understand that if it's good for those individuals, it will only benefit the broader community. And so again, I think data will be important in how we proceed and how we look to really leverage resources as well as really pinpoint our services to the most need in this community.
And so I think what the pandemic did was kind of disabuse us of some of the false narratives we live by and awaken us to the desperate needs that all of us have. And I think it opened us up to the humanity of those who experience homelessness every day. And so, you know, what I hope will happen is that the way we kind of changed our approach in order to respond to a global pandemic will create a new sense of creativity and urgency in how we respond to problems that were already there. It became much easier to get funding for frontline work. It became a much quicker turnaround to mobilize resources. And that's just not the case pre-pandemic. To do this work, to fight this fight was too hard to mobilize supporters, to get funding, to build collaboratives. All of that was difficult pre-pandemic. And to see how easy it became for us to mobilize, get money out, get people on the front lines, show up and step up, I hope we'll take some lessons from that in how we respond to chronic homelessness in our city moving forward. Let's continue to step up and let's make a difference now, and let's keep that sense of urgency.
Thank you to Ellen Magnus, Shanette Eden, T.C. Broadnax, Dr. Fred Cerise, and John Seibert for sharing your perspectives on the past year. There's a couple things that really stood out to me in that section. Number one, we are in a unique moment in time when all the systems that have been running in parallel in the past are coming together to work together with a collective impact. Number two, data is an invaluable tool to help us build programming. And through the use of data, we are getting much better at targeting our resources to make the biggest impact possible. Data is an invaluable tool to help us build programming that can impact the lives of clients. It allows us to target our resources to make the biggest and most strategic impact possible. In the future, you will continue to see the Homeless Collaborative and MDHA utilize data to identify and target priority populations, pinpoint and engage in targeted interventions, implement streamlined services, and ensure capacity to deliver best practices. By tracking strategic data points, we can make better decisions. HUD has already defined several of those data points and required that we track them. They are the number of homeless people, the length of time people remain homeless, the extent to which people who exit homelessness to permanent housing destinations return to homelessness, job and income growth rates for homeless people, the number of people who become homeless for the first time each year, and successful housing placements. So let's talk about the first data set, the number of homeless people in our counties. Communities use the annual point-in-time homeless count, or the PIT count, to provide a snapshot of who is experiencing homelessness each year. The data should not be looked at as absolute, but it is useful to compare increases and decreases in homelessness year after year. It also gives us a good idea of the basic demographics of people experiencing homelessness. MDHA, as the lead agency for the Homeless Collaborative, is responsible for conducting the PIT count every year in Dallas and Collin Counties. Now, the next few things I'm going to say are caveats about this year's data, and the reason will become obvious. First, COVID-19. Communities around the country wrestled with what to do with the annual count this year. It was clear that we could not send volunteers to interact with a medically fragile population, and so we could not use volunteers this year, which fundamentally changed how we organized the PIT count. Instead, we conducted a count utilizing outreach teams with no volunteers, using a very brief survey over 14 days starting on February 18th. We would like to thank Yolanda Williams and Crystal Lotspeech of City Square and the entire PIT work group for leading this effort. We also would like to thank the over 110 outreach staff who helped conduct the count during the day, night, and on weekends. Now here is yet another caveat. Winter Storm Uri. The storm hit North Texas, as I'm sure we all remember, on February 13th, and it lasted for about a week. As a result of that, cities and nonprofits all over our area opened warming shelters, and people experiencing homelessness were put up in hotels and motels. I think we all remember it was not possible to stay outside. It was so cold. In addition to that, because of pipes bursting, some of our year-round shelters lost power, suffered substantial hits to their facilities, resulting in clients having to transition to other shelters or warming stations. All of this is to say that it is very difficult to draw conclusions from these numbers because they are not really an apples to apples comparison with past years. Here are some results. This year, we found 4,570 unduplicated individuals who experienced homelessness in Dallas and Collin counties on the night of February 18th, 2021. While you can see that the emergency shelter numbers increased, I want to refer you back to some of the caveats that many people who might otherwise have been unsheltered were in warming stations, which under HUD guidelines are counted as emergency shelters. If not for the winter storm, we estimate that about 600 of those individuals would have been in the unsheltered numbers. This just underscores the difficulty of using this data for comparisons. I'm now going to take you through a variety of different categories of people experiencing homelessness, and I'd like to give one piece of commentary before doing so. You're going to hear me repeating over and over and over in the next few minutes 3 words: male, non-Hispanic, and Black, because that is the demographic that is way overrepresented in almost every category of homelessness. And I want to give that statement up front to acknowledge it. And later in the presentation, we'll be talking about what it is that we're trying to do about it. When we compare Dallas and Collin counties, about 10% of the clients resided in Collin County on the night of the count. Our data showed that 465 individuals were counted in Collin County out of the total of 4,570. About 285 individuals were in a shelter and 180 were unsheltered. The unsheltered count for Collin County is similar to 2020. For the unsheltered population, we were able to capture length of time of homelessness. About 40% had been homeless for 1 to 3 years, and another 1 in 3 were homeless for 3 years or longer. In the total population, about 9 out of 10 people experiencing homelessness were over the age of 24, and about 1 out of 12 are under the age of 18. People who are experiencing chronic homelessness represent a particularly vulnerable population and are prioritized for permanent housing. We identified approximately 500 chronically homeless individuals. This number has not changed since 2020. This year, we found 370 veterans. Approximately 80% were in a shelter. Of these 370 veterans, 13% were classified as experiencing chronic homelessness. Now let's look at our youth experiencing homelessness. They also skew male, non-Hispanic, and Black. On the night of the count, we found 551 homeless people in households with children. Over 52% of them are Black. What we know is that households with children were more likely to be in transitional housing than in emergency shelters. You will be able to read about all of these data points and more in the 2021 COVID-19 point-in-time independent analysis conducted by UT Health researcher Dr. Catherine Troisi. You can find the independent report on our website by clicking on the Homeless Pit Count page. Let's take a look at a few of the other performance measures we mentioned before. Length of time of homelessness. It takes clients about 100 days to get into housing today. This length of time has been steadily decreasing since 2015 as our community has moved away from transitional housing towards the evidence-based practice of housing first. We are digging deeper into this metric to examine racial disparity in these numbers. We know that it takes African Americans longer to get into housing, and we are working hard to understand where exactly in the system they are being treated differently. Returns to homelessness. We know that currently about 21% of clients we place into housing return to homelessness. When we analyze the data, we know that the type of housing intervention affects an individual's ability to maintain housing. It will come as a surprise to no one that the better we get at assessing clients' needs and matching them to the right type of housing, the more our rate of returns to homelessness will decrease, and reducing inflows helps reduce the rate of homelessness. We have already seen a decrease in the rate of returns from clients who are placed in permanent supportive housing. For instance, only 4% of the veterans we placed returned to homelessness since May of 2019. We are also in the process of breaking down returns to homelessness by race, gender, and ethnicity so we can understand what inequalities exist. It's important to count people who are experiencing homelessness for the first time. A person who is homeless for the first time requires very different interventions than someone who is chronically homeless. People who experience homelessness for the first time often need shorter housing interventions and less intensive services as those who are disabled and have experienced homelessness for many years. As first-time homelessness increases, we have got to work hard to increase our inventory of interventions like rapid rehousing. Thanks to available funds from the CARES Act last year, our system has gone from 18 rapid rehousing projects at the beginning of 2020 to 47 projects now in Dallas and Collin counties. These programs have helped to house almost 1,000 people already. We all know that the solution to homelessness is a home, but not all housing types are right for each person. Just like anything else, people have individual needs. The better we get at identifying a client's needs and then their housing needs, the better we will get at ensuring that they stay in their homes. But the long and short of it is that we need more affordable housing units. MDHA is actively working to incentivize landlords to work with our homeless collaborative programs. Long term, as a community, we have got to figure out how to increase affordable housing development. So we just shared an immense amount of data, and I'm sure it will take a while for everyone to digest it. But the truth is, that's really just half of the data in our community. Most of that data came from our HMIS, or Homeless Management Information System. And the truth is that many people watching today who serve clients experiencing homelessness do not enter data into the HMIS system. That's why today I'm pleased to inform everyone that we have made it much, much easier and much more frictionless for you to participate in HMIS. We are building a data warehouse system, and that system will automatically upload data from multiple systems into one system so that we can have a clear picture of homelessness for Dallas and Collin counties. Now, I know that in the past, it has been difficult to interact with our past attempts at an HMIS system, and because of the feedback we've received, we have implemented this data warehouse. And what I want to say specifically is that we will not be asking any agency to change their operating system or change how they conduct their day-to-day business in order to participate in HMIS. The data warehouse does all that translation for us. We all know that we can't manage what we don't measure, and HMIS is the #1 tool that will help us to end homelessness. And it is to everybody's benefit to participate, because the better we get, the more federal funding we get, and that's more money for us to continue our work. So it starts with getting great data from across the ecosystem, and that begins the virtuous cycle. We cannot walk away from today without recognizing and naming the fact that systemic racism is reflected in homelessness. Black men are disproportionately represented, and it's great to recognize it, and it's great to name it, but it is far, far from enough. MDHA and the Homeless Collaborative have been working on this issue under the coordination of our Racial Equity Steering Committee. And we work in partnership with a group of organizations, including C4 Innovations, Dallas Truth, Racial Healing and Transformation, United Way of Metropolitan Dallas, Parkland Health and Human Services, Lone Star Justice Alliance, The Bridge, and Faith Forward Dallas. Regina Cannon of C4 Innovations is a nationally recognized expert, and she is working closely with MDHA staff as well as leaders of our homeless collaborative organizations and selected work groups. It is safe to say that racial equity is a key factor that we are looking into in every aspect of our work. In partnership with the Dallas Truth, Racial Healing and Transformation, we also kicked off racial healing circles for people of color navigating systemic racism for themselves and for their clients. As I said a moment ago, everything we do is being looked at through the lens of racial equity, and we are constantly analyzing our data to create better systems and processes. You can find more information on our website under racial equity. However, we can't kid ourselves. Just as homelessness is a symptom of significant failures in our society, the overrepresentation of African Americans in the homeless population is just a symptom of a much, much larger issue. One final note on this issue. The damage is done by the time someone has become homeless. If we really want to solve this problem, we have got to address the societal systemic racism that leads to the results we see in the homeless population. Mass incarceration, employment discrimination, disproportionate poverty, and so many other factors cause African American people to become homeless at much higher rates. We absolutely cannot accept that. Now I'm going to hand it off to Ashley, who's going to share our big goals for the coming years.
In the coming year, the Homeless Collaborative and MDHA have three big goals: to end veterans' homelessness by the end of this year, to reduce chronic unsheltered homelessness by 2023, and to reduce family and youth homelessness by 2025. Our first priority is ending veterans' homelessness by this year. Over the past year, we've prioritized veterans receiving housing in our system, created a projection tracking tool that's in use to help improve data quality and maintain pace, added dedicated navigation staff support to work with landlords to identify units, and moved veterans into housing faster. In fact, we've housed over 700 veterans in the past 2 years. Our second goal is to house 550 persons through a rapid rehousing surge. In response to the COVID-19 pandemic and the recognition that housing equals healthcare, the federal government allocated funding to ensure individuals stay in their homes or are moved into housing as soon as possible. Over $51 million so far has come through our systems to prevent individuals from becoming homeless or rehouse individuals experiencing homelessness just in Dallas and Collin Counties. I'm going to hand it back over to you now, Peter, to close us out.
We hope you walk away from this address a little more informed and inspired to act, because each and every one of you, every person watching this presentation has a part to play, and we have all got to work together. Funders, please align your support with data-driven collective impact efforts and support members of the Homeless Collaborative. Agencies, thank you if you already do participate in the Homeless Collaborative and HMIS, and if you don't, please consider joining us. Citizens, we all know the importance that having a stable housing situation has in our own lives and our own ability to thrive. And we also understand that every human being needs that. We all believe that everybody deserves this opportunity. So what can you do? Call your representatives and make sure they hear you say, yes, in my backyard, yes, in my community, and that they have the support to make the right decisions about approving affordable housing all over our community. We invite you to follow us on all communication channels to learn more about how you can vocalize that support. Without adequate housing, we cannot end homelessness. We thank you so much for joining us today. We look forward to working with you to ensure homelessness in Dallas and Collin counties is rare, brief, and non-recurring. Finally, we encourage you to join us for this year's Hard Conversation series, discussing what kind of community do we want to build, and presented by the Apartment Association of Greater Dallas. You can find more information on our website, www.mdhadallas.org. Thank you so much.